Hey everyone, welcome to this explainer. If you've ever watched a master clinician at work, it's almost like magic, right? They seemingly pull a spot-on diagnosis out of thin air in a fraction of a second. Well, today we are unpacking a truly fascinating presentation brought to us by Dr. Christophe Delong and Kinexa formation called The Anatomy of Clinical Intuition. We're going to discover the exact mechanisms behind that split-second magic. So it's incredibly easy to look at a seasoned expert and just assume, oh, they have a gift or some kind of weird sixth sense. But actually, scratch that. As we're about to uncover, expert clinical reasoning isn't magic at all. It is a highly measurable architecture. We're talking about a literal physical rewiring of the brain that's built over time. To see how this all works, we'll follow a pretty structured journey today. First, the magic of intuition. Second, a physical brain transformation. Third, the dual decision flow. Fourth, the traps of automation. And finally, transmitting and cultivating expertise. Let's dive right in. All right, Section 1, the magic of intuition, decoding the split-second diagnosis. We're going to look at what actually happens when an expert spots an L5 spinal issue, or, say, a really subtle postural asymmetry in mere milliseconds, literally before they've even consciously thought about it. Okay, so the absolutely crucial takeaway here is that expertise is purely biological. It's not just knowing more facts, it is a literal cascade of physical changes, synaptic, structural, and myelinic. Essentially, your brain takes a diagnostic process that used to be super slow, heavily controlled, and honestly kind of exhausting, and transforms it into something lightning fast, predictive, and completely automatic. You are physically building a faster biological processor to save metabolic energy. How cool is that? Which brings us to Section 2, a physical brain transformation, rewiring the expert brain over time. Let's zoom way into the micro level to see exactly how your brain physically changes its shape and function. Now, this transformation doesn't just happen overnight. In the super short term, we're talking milliseconds to hours, your brain is mostly just tweaking synaptic efficiency, like maybe learning a new clinical sequence in a single day. Over days and weeks, those new networks stabilize, and a lot of that actually happens while you sleep. But over months and years, that is when the heavy lifting happens. Your brain undergoes actual structural remodeling. It thickens the myelin sheath around nerve fibers to literally insulate the wires for faster transmission. It's kind of like upgrading your brain from dial-up to fiber optic. What's really fascinating is how specific brain regions adapt to handle these tasks. Take the visual cortex, for example. It gets drastically better at extracting features instantly. You might notice a postural asymmetry before you've even properly greeted the patient. And get this, activity in the prefrontal cortex, the conscious, analytical thinking part of your brain, actually goes down in experts for familiar tasks. You are literally thinking less. Meanwhile, the striatum and cerebellum take over the show, chunking your visual and motor movements into seamless routines and predicting patient dynamics before they even happen. Of course, these structural changes don't just happen in a vacuum. They're powered by a very precise cocktail of neurochemicals. Dopamine acts as your reward signal, reinforcing procedural learning and solidifying diagnostic habits. Then you have acetylcholine, which heightens your focused attention when you are actively trying to learn a new pattern. And noradrenaline? That kicks in during emotional or high-alert situations, pretty much searing those rare, intense cases permanently into your neuroarchitecture. So, having seen the physical rewiring, we can now explore how this operates in the clinic. Welcome to Section 3, the dual decision flow, the fast implicit and slow explicit pathways. This right here is the core mechanic of expert reasoning. It's a double flux or dual flow system. First up is the implicit pathway. This happens in under 500 milliseconds. It completely bypasses conscious thought, using the basal ganglia and cerebellum to recognize patterns instantly. This is exactly what you feel as a gut intuition. Then, and only after those 500 milliseconds, the explicit pathway kicks in. This uses the prefrontal cortex to analytically justify what your implicit brain just handed you. So you know that classical idea that clinicians carefully gather data and then consciously arrive at a diagnosis? Well, that's actually backwards for an expert. The real sequence is intuition, then verification, then explication. Your conscious brain's main job is simply to test and verify the implicit brain's instantaneous draft, just making sure your automatic pattern recognition didn't miss a beat. This logical six-step pipeline shows the exact dance between your unconscious and conscious mind. It starts with your vision automatically extracting clues. which instantly activates an implicit hypothesis. It's only at step 3 that the prefrontal cortex steps in for a rapid coherence check. If everything aligns, you move to targeted tests, formulate an explicit diagnosis, and finally, structure your communication for the patient. It's honestly a beautifully choreographed biological routine. But, and this is a big but, this incredible neural efficiency comes with a dangerous downside. Let's address Section 4, the traps of automation, the hidden risks of a highly optimized brain. Because our brains are ultimately energy-saving machines that love a lazy shortcut, highly experienced clinicians become susceptible to some very specific biases. When your implicit brain is convinced it knows the answer in under 500 milliseconds, you risk inattentional blindness, which is literally not seeing new or conflicting signals right in front of your face. You might fall into confirmation bias or develop tunnel vision when a case is actually atypical. Your brain gets so optimized for the familiar that it goes blind to the unexpected. Fortunately, we can hack our own biology. Implementing really simple guardrails, like forced cognitive pauses, can easily protect against these automated blind spots. Taking just 10 seconds to run a mental micro-checklist or forcing your prefrontal cortex to generate one mandatory alternative hypothesis brings that explicit brain back online. It disrupts the automation just enough to keep you sharp and make sure you aren't missing vital clues. All right, that brings us to our final section. Section 5, Transmitting and Cultivating Expertise, Actionable Methods for Acceleration. Let's zoom out to the macro level to see how we can actively extract, teach, and safeguard this biological intuition. Whether you're an educator or honing your own skills, you really need to recognize what accelerates neuroplasticity versus what puts the brakes on it. Deliberate practice with immediate feedback and high case variability, those will absolutely accelerate your structural brain changes. On the flip side, monotonous practice with no feedback, poor sleep, and chronic burnout, those act as severe brakes, stopping that vital myelin and synaptic growth dead in its tracks. Now, a major challenge for experts is that their knowledge is largely implicit. They often don't actually know how they know something. But by using specific interventions like eye tracking or video replay, literally pausing a recording at 0.5 seconds and asking the expert, hey, what exactly did you see just now? Educators can successfully make this implicit knowledge explicit. Getting an expert to think aloud exposes the automatic microdecisions of their basal ganglia. The takeaway here from medical curricula is profound. When building these programs, educators absolutely must transition from showing neat, typical cases to messy, borderline cases. And crucially, you can't just show the physical execution. You must explicitly reveal the why. You have to expose those hidden chunks of information so the novice brain can start building its own patterns. If you want to start rewiring your brain tomorrow, here's a highly practical action plan. Over the first week, record 10 cases a day, take 5 minutes to review them, and note 3 key clues you relied on. By 30 days, force yourself to introduce variability. At 90 days, rigorously evaluate your performance metrics and diagnostic concordance. Track this across a year, and you will actually be able to measure your own biological transformation from conscious struggle to intuitive mastery. I'm going to leave you with this final, provocative thought straight from Dr. Christophe Delong and Kinexa formation. Neuroplasticity is a double-edged sword. Yes, it physically optimizes your brilliance, making you incredibly fast, but it will just as efficiently optimize and hardwire your mistakes if left unchecked. Your brain has automated your expertise, but have you automated your errors? Let that be a reminder to always challenge your clinical intuition. Thank you so much for joining me on this explainer, and keep learning.